Hi, everybody. I'm really say thank you, 12 points to the team here from Switzerland. Everybody from Switzerland here in the area? No? Have you been to Switzerland? Great. Hopefully you don't go to hospitals there, even if they are the best in the world. But I want to say something about me, something about my company, and something about the client, and something about the approach we took and what are the results. And in the end, we said, okay, what will be the way we want to do in the next steps for bringing Targetprocess more in healthcare, because I think there is a big need for solutions like Targetprocess in healthcare. My name is Jürgen Müller. I studied computer science and medicine, mostly both. But and then I worked for one of the big 5 consulting companies for years, and then decided to own my own consulting company. And after 7 years, they asked me to be the CIO of the second largest university hospital in Switzerland. So I've seen all the roles you can have in that healthcare thing. Was part there of the management board. And since 2014, I'm still back on consulting. But now I don't call myself a consultant, I call me a healthcare expert. That's the difference. So I start also with a quote, and sometimes you say, okay, he's presenting a tool, and why he's using that quote. Most of the people don't know this guy. He's really one of the brains in the world. He developed a lot of technologies you're all using now. And he came up with the quote, "A fool with a tool is still a fool." What that means and why that's my headline here. The client where I was going into 2 years ago, they were working with Targetprocess, but we have a project manager working with Targetprocess, we have a developer working with Targetprocess. We had about 50 people with Targetprocess, but they're still doing the same things. They didn't change any process. The result was 0. Yeah, that can be. So the client, old-fashioned, found it. Look at that. This is maybe the oldest company presenting here. But we are not the oldest customer of Targetprocess. And the business is a hospital. It's a group of 5 hospitals with about 15,000 people working there every day. And they just doing a quite good job with a revenue of 1.8 billion every year. That's a lot of money for a hospital. And we have about 9,000 daily users in IT. And there the problem starts. What is not on that slide is the number of applications. We have about 25 main applications like SAP, but for every department we have a different application. So the support of the whole thing is big, and nobody really knows what's going on in that part. And they have a lot of challenge. Also hospitals now talking about digital transformation. Why? Because their customers, they want to get information out of the hospital. They have to be integrated get in the hospital, have the information out. So digital transformation hits them as every other company in the world. And the other thing is, the university hospital is a research hospital, so they do a lot of research. And the new innovation in that part, they do every day a new thing. And most of the new things need to have support by IT. And so we have the digital transformation, we have all this innovation in medicine, and in the end, we have to generate a lot of new IT solutions. Problem is, and in addition to that, we have a lot of customer demand that changes in the last 3 years totally. They said, what are you doing in the IT there? We want to know what you're doing. We spend a lot of money into you, and we have no result. We don't know what to do, so we have to answer that customer demand much faster than we did in the last years. And in the end, it's the same thing like most of the companies have here. In the IT departments, you have much more projects with the same resources, financially and on man. So our approach was, okay, what we need first is an integrated project management and portfolio management approach so that we see what's going on and how we can do that, what we need to do. And so the first thing what we need to do is to prioritize the projects. And then some started with implementing agile project management methods, the other do the classical waterfall project. So this is a problem bringing both things together, but we try to do that too. And the main focus was having the resources on the right place on the projects. This was our main focus. So this was the starting point when we go into that, in that situation. When I was there as an interims manager for IT, 2 years, I started 2 years ago. We have a process from the idea to delivery, and it's supported by, you see that, SharePoint, totally different view tools, no interaction, a lot of different resources where information comes in and has to go out. And what we decided, yes, we decided to do 3 things. To improve our demand management process, to get the customers more in, to do a portfolio management, and to do a project management. And just go through the demand management. What we did first, before we implemented Targetprocess, we changed the way they work. We put the clients into charge in helping us get the demands right to the IT. And for that, we use Targetprocess. I'll show you how. We implemented that as a new process. That's the IPPM process. This will be the standard worldwide in the next 10 years. I'm kidding. But we do that like we implemented that process. We put that in that workflow tool here and say, OK, this will do workflow. And then we set up standard views in Targetprocess and integrate it with our intranet. So all the demands, the requests coming in and were put into automatically here in that fight. And so the teams can see what's coming in and how to react. And the next step out of that is going from that, we're going directly into the portfolio management. The team, together with the clients, said, OK, what will be the priorities? Normally, IT said, we do that. And after that, they asked the client, is this the right thing we do? We changed it. We said, in the beginning, before we start, we asked the client and put them into charge, what will be the 5 prioritized things we just start now? And that's also, we supported that with views from Targetprocess. This is a list of the things, example, the last 2 weeks, new ideas coming in, so that everybody can see this was the things we need to do in the next time. And then you say, OK, what will be the we have something like a prioritized list then after that. And after that, we say, OK, how we can start the whole things. I'm just doing a little bit. If you want to see more detailed things like that, ask me. But I don't want to go to every slide here, explain that. We check how can we start that very fast, what is needed, which information is missing, who need we talk to that we can start the project much faster. Result was initiation phase from before integrated or before working with Targetprocess was about 8 to 12 weeks. Now it's 2 weeks. And this is what the client really like. They say, okay, now we know if we have a request, they will answer in 3 weeks or 4 weeks, and that's important. And so we have a list of projects, what we're doing. We're doing about 250 projects, actually, with Targetprocess. And so this is the list, just the beginning of the list. And so we plan what we can do, which team can it do, and so on. When you have the list with all the things, then you have to, normally you choose a different tool and go into project management, but with the same thing, we just do here. So we say, okay, now we are in planning. We say, okay, this is the overall timelines where we say, overview, if you have the priorities list, we say, this will be possible, then. Ask to the client when you need it, ask to the resources, is this possible from the team to do that? And if we have a go on both sides, we say, yes, start it. And then we do detailed planning, and somebody in this morning said, okay, we have blueprints. So for standard projects, we have blueprints, using the blueprints, so that they are able to plan these projects very fast. You see, I need that for that project, put it in, and planning is about 1 hour, not 3 days, 1 hour. And then you have the standard deliverables for this project, and you assign it to teams, and then you, 1 minute, thank you, okay. You assign it to teams and do then detailed planning on what we have to do in the timeline, but we only plan the deliverables by time, not the tasks. Just the time, not the task. And this is also detailed planning. What the big benefit for the workers in the project is that they have one view, and you see this is the thing they have to do today, tomorrow, and what's planned for the next week. So we have one view, and that's how they work. They do the things, they document, they done the things, that's it. The effort is absolute minimum, and that's it. So we rolled together that into the hospital from 1 department now to 3 in 7 months, yes. And actually, we are working together to do that to other hospitals in Switzerland. And the other idea is to say, okay, this is an approach, maybe this can also help your company to doing things like that, an integrated portfolio project and demand management process, so we can help you together with Targetprocess to bring that to you and help you through your digital transformation. And at the end, last sentence, healthcare is different from most of your businesses you have, because it's very hierarchic. You have kings dressed in white, and they say what you need to do. And my thing is that if you can make it there in healthcare, you can make it everywhere. Thank you.
Thank you, Jürgen.